MIPPA e-Prescribing Incentive Program. How to avoid Medicare 2011 eRx penalty. Medicare Physicians Alert. To avoid the Medicare e-Prescribing penalty in 2012, you must act by November 1, 2011. There's something called Medicare Improvements for Patients and Providers Act of 2008. Those unaware of the term MIPPA refer to this electronic prescription program as the Medicare eRx Incentive Program or Medicare e-Prescribing Incentive Program. What MIPPA means to you, the Medicare physician, is that you can get money from the government if you write electronic prescriptions/engage in e-prescribing. MIPPA is a 5-year program providing eRx incentive payments-free prescribing until 2013. What about the e-prescribing penalties? Along with the incentive payments, there are also penalties. I wrote about this in my June 30th article, Electronic Prescriptions. Is Medicare slapping you with an e-prescribing penalty? http://electronichealthrecordrescue.com/healthcare/news/electronic prescriptions. Is Medicare slapping you with an e-prescribing penalty? June 30th, 2011 was significant because it was the last date to avoid the Medicare penalty in 2012. You needed to use e-prescribing for 10 prescriptions by the date. If you didn't, you're due for a penalty. What are the Medicare MIPPA rules? Here's the whole deal. 2011 e-prescribing is the basis for the 2012 and 2013 e-prescribing Medicare penalties. And penalties mean adjustments under MIPPA. Prescribe on 10 Medicare encounters before 6/30 to avoid a 1% reduction in 2012 Medicare rates. Prescribe on 25 Medicare encounters by 1/2/3/1/2/0/1/1 to avoid a 1.5% adjustment in 2013. By prescribing 25 times, with G-code G8553, you can also earn the 1% prescribing incentive in 2011. Eligible physicians can participate in both the eRx Incentive Program and the Physician Quality Reporting System/PECOS Incentive Program. MIPPA rules do not allow you to collect the e-prescribing and EHR incentives in the same year. See Understanding the Basics of Medicare's Electronic Prescribing Incentive Program, http://ask.org/resources/deck/hit/fac/cms incentive program.pdf for more details. How do I get incentive payments? Since you cannot get MIPPA and EHR incentive money in the same year, not qualifying for the High-Tech Act EHR Incentive Program will work for you in 2011. You still have 2012 to qualify for the full High-Tech Act Electronic Health Record Incentive payment of $44,000 for adoption of EHR software. So, collect the MIPPA incentive in 2011 and start pursuing meaningful use in 2012. What you must do to get the MIPPA year-end e-prescribing quota is either e-prescribing software or a certified electronic health record system. How can e-prescribing penalties be avoided? Many Medicare physicians were blind-sided by the MIPPA penalty for not writing 10 electronic prescriptions by June 30th. Too late to fix the fact that you're liable for the 2012 penalty. You must adhere to MIPPA requirements to avoid the future penalties associated with that program. How to apply for the e-prescribing exemption. You must apply for the e-prescribing penalty exemption by November 1, 2011. Step 1. Get NPI number and password. Access the national plan and provide your enumeration system/NPPES to get an NPI number. The Health Insurance Portability and Accountability Act of 1996/HIT-AA mandated the NPI number as the unique identifier for healthcare providers. Here's the NPPES link: https://nppes.cmshhs.governor/nppes/static_do. Forward equals static.instructions. Step 2. Register in PECOS/provider enrollment, chain, and ownership system at https://pecos.cmshhs.governor/pecos/login.do. You will need your NPI number and password to log into PECOS. If you need assistance with your NPI password, call 888-734-6433. Step 3. Determine your electronic health record software ID. If you do not have electronic health record software, skip to Step 5. The first exemption option is, I registered to participate in the Medicare or Medicaid EHR Incentive Programs for 2011 and have adopted certified EHR technology. If you are claiming an exemption because you have purchased an electronic health record software, you will need the EHR software certification ID. Note: there are references to a requirement to register your EHR software by October 1, 2011. But the exemption form does not ask for the date. To find the CMS EHR certification ID number, 1. Go to http://chplace.force.com/airsfort/prepared search. 2. Select ambulatory. 3. Enter part of product name, for instance waiting. 4. Click Add to Cart. 5. Click Get Certification ID. 6. Copy this ID for use in the incentive program registration and the eRx exemption process. Step 4. Register for the EHR Incentive Program and get your registration number. https://eRx Governor. Step 5. Apply for hardship exemption. Here's the exemption link: https://qualitynet.org/portal/server.pt/community/communications support system/234. You will need to make a justification statement in addition to filling in the form. See Applying for the eRx Hardship Exemption Step-by-Step Guide http://www.focs.org/ep/eRx exemption.pdf for sample hardship statement verbiage. Now that you've handled the penalty, you can enjoy the benefits of e-prescribing. Got questions? About the HITECH Act, electronic health records, meaningful use, or the Centers for Medicare Medicaid Services/CMS EHR Incentive Program? I invite you to claim free access to an informative interview audio titled How to Convert to Electronic Health Records When I'm Completely Technology Adverse and Don't Know Where to Start. Enter your name, your email address and your phone number below, and click I want a CD. Is electronic health record adoption a mystery to you? Don't have the time or expertise? Want to take advantage of EHR incentive money? Call Sandra Noble at 404-374-3384 today to schedule a free consultation and find out if you qualify for other free EHR and HITECH Act meaningful use assistance. Sandra Noble, 404-374-3384. Georgia, hit received. Noble Finances. Noble & Associates Consulting, Incorporated.